Welcome to Connections, the podcast from addiction professionals of North Carolina, where we explore the nuances of addiction and mental health through the lens of policy and practice.
We're your hosts, Morgan Coiner
and Sara Howe,
and we're here to help you see how it all connects. Today on the podcast, we have Becca Sweeting, who is the Information Referral and Data Team Lead at the Alcohol Drug Council of North Carolina. Becca, thank you for joining us.
Thank you for having me.
Of course, yes. So before we get into sort of the main part of our conversation today, can you just tell our listeners like who ADCNC is and what service you provide to our state?
Sure. So Alcohol Drug Council of North Carolina is an organization where we aim to help people recover from substance use and mental health conditions. We have a call center where people can call in to learn about and find providers and other treatment resources for substance use and mental health. We try to advocate and just kind of try to fight stigma. That's what we do as an organization.
Awesome. That call center, really quickly, will you just tell us the phone number? I want to make sure we get it in.
Yes.
And don't forget, tell us that phone number, because if anybody listening needs to write it down or knows someone who could use it, I want to make sure that we get that out there. So tell us who they will call to get some help.
Sure. You can call 1-800-688-4232.
Awesome. And you have an incredible team of people answering those phone calls and trying to fielding those requests. In our conversation today, what I really want to talk about is some of the information you're able to gather from those calls. Like, y'all really sit at the center of this crisis in our state, because you day in and day out are talking to the individuals who actually are in that pivotal crisis moment where they are ready to make that decision to get help. And that is a really special place to be. And so just want to hear from you kind of like, what trends are you seeing in our state through those phone calls that you're receiving?
Yeah, sure. So in this last fiscal year, we received over almost 11,000 calls. And through all of those calls, alcohol and opiates were always in the top three areas of substance use that we hear about from our callers. And then cocaine and methamphetamines have been coming more and more into play as well over the last year or so. Other trends are our main age group that we hear from is between the ages of 26 and 34. Less than 2% of our callers are under the age of 18, but that doesn't mean there's not a need for treatment, for more treatment providers for those callers, of course, because there is a huge need. 51% of people call for themselves, and 49% of people are calling for a loved one, which I find very interesting. It hasn't always been that 50-50 percentage range. It's usually been where people are calling, for themselves more so than the alternative. Yeah. So
when you're talking about calling for yourself or calling for a loved one, and the statistics that you were mentioning earlier, like the 18 and under that you're seeing are calls, do you mean they're asking about services for 18 and under? So in that entirety of that 100%, or are you saying it's 18 and under that aren't calling for themselves? If that makes sense.
So can you repeat the question?
Sure. I guess what I'm trying to tease out is in the numbers and what you're tracking when you're saying you're getting your biggest call is like that 26 to 37 age. Does that mean those are the actual people calling, or they're calling about services for age 26 to 37?
It just kind of depends on the caller. I couldn't tell you how many of the people between 26 and 34 are calling for themselves or for someone else.
So it's what they're looking for. They're looking for service, whether it's for themselves or someone else. The age that you are seeing of people needing services in the state, the biggest bulk that you're getting calls about, like you said, I think you're right. That doesn't mean there's not a need under, but it's that really that middle, It's not really middle age. It's the early middle age.
It's
right.
26 is young.
Yep.
Yeah.
You know, and I remember when I first got into recovery, like people told me I was so lucky because I was starting so young and it took them so many years to get there. And so it's actually really exciting to me to hear that that's one of the more common calls because, you know, if you enter recovery at 26, you could have 50, 60 years in recovery. Whereas you know, when you get into recovery at 65, and it's interesting, you know, just to see that trend of younger people wanting to get healthy.
Yep. So in that age, that big bulk that you're seeing, what's their highest trend? What a drug of choice are they asking about? Is it still that alcohol and opiates?
It's opiates and opioids.
Okay.
So we've got, when I say opiates and opioids, I'm kind of grouping everything together. I'm grouping methadone, heroin, fentanyl, as well as RX opioids together.
Okay.
The highest of those four categories, though, is fentanyl. And for that age group, it's, I can't say whether or not it's fentanyl or heroin, but it's definitely within the opiates and opioids category.
That's people using fentanyl, not like I was using a different substance and it was laced with fentanyl. That's people who are actively using fentanyl.
Yes.
That's a really good distinction.
And it's really scary.
Yeah.
I mean, there is a lot of fear and a lot of misinformation about fentanyl of like, oh, if you touch it, it'll kill you and things like that. Like there are people who actively use it and yet it is also actively killing hundreds of thousands of people in our, well, not that many in our state, but in our state and in our country. It's scary that that's a substance that people are able to find and get access to.
Yep. So then my next question going down that road is getting people help. Where are some of the biggest gaps where you're having the biggest challenge connecting them to the resources?
Yeah, for sure. So there are a lot of programs for women and children, which is excellent. And again, we need even more. But women without children is a huge gap. There are a lot of faith-based programs. There are a lot of different work programs that women without children can go to. But as far as finding programs with a clinical setting, that's on an inpatient or residential treatment provider, that is a huge area where we have a hard time finding programs. Faith-based programs and work programs, they're amazing and they save a lot of lives, but they're just not for everyone. So, that's a pretty big gap. We've got people with medical needs. That's another huge gap. People that are on dialysis, people that are on oxygen, people that are type 1 diabetic and have to inject insulin on a daily basis. A lot of programs won't take people with conditions like these, and that's a huge gap too. And it's tough to know where to point, the right direction to point in. Definitely.
I wonder if you could tell us also, and we can put some of this in the show notes, but for anyone listening to this who's like, hey, my program does that, and I want to make sure that I'm on your list.
Yes.
Because if you're having trouble placing people and my census is low, I want to make sure we're vibing. So how can people get listed, and do you have a database? Like, how do you organize all this information? There's tons of providers doing work in this state. How are you able to?
So we do. We have a database, and we actually just created an external tool called the resource directory. And that is a way that people can actually visit, create their own account, and then submit their information for their agency directly to our website. And then all I have to do is go in, check it, and then approve it, and then it'll be in our database and on our external facing resource directory. So that's one way. Another way is to call me, and I can walk them through the steps of getting into the resource directory. I can give a direct phone number if you'd like to get in touch with me.
A phone number, or if you want
or
an
email. Your email.
Yeah, sure. So my email address is rsweeting@alcoholdrughelp.org.
And we'll put that in the show notes so you don't need to spell it out or anything.
Right.
we'll make sure that they can access that. I just want to make sure, like, right, the podcast is called Connections. Like, as many people as we can connect back to you to make sure that you can then connect folks to those services is really important to us. You know, like, it's a huge resource for our state to be able to have one number that they can call and say, I need help, and have someone on the other end say, great, like, I have some options for you.
I think it's helpful to give our listeners that aren't in this field. I mean, we hope we're really actually reaching those people that are not in this field, but want to know more about the work that we do. When they call you, you're able to provide a referral source. But let me make sure I'm correct about this. You're not doing an actual assessment. You're sending them to a potential provider that will do that clinical assessment for that level of care. Am I correct in that?
That's correct. What we're doing is a brief screening. So we're asking just a few questions to get an idea of where to send the person, the best places to send the person to through that screening.
What kind of questions might they expect if they're calling?
Yeah, sure. So what they're using, we ask how they're using it. So the route, how often they're using it. We ask their age. We do ask for a zip code. A lot of state-funded providers require that you live within a certain catchment area in North Carolina to be able to go to their facility at no cost to you, the patient. So that's why we ask for the zip code, but we do have the ability to look through the entire state. We ask whether or not they've served in the military, because there are different resources. We ask if they're pregnant or if they have children, because there are different resources.
Okay.
So we ask questions like that just to get a basic idea. We definitely don't want to just send people to 15 phone numbers that are going to send them to 15 more phone numbers that are going to send them to one provider that might be able to help. We want to eliminate that. So that's kind of why we go through that screening.
And they can be anonymous, right?
Absolutely. And if somebody doesn't want to answer any of the questions, they don't have to. Our main goal, we want to gather information so we can kind of study what's going on in North Carolina. But if the person isn't comfortable answering certain questions, we're not going to force them. We're still going to help them the best way that we can.
Great.
That's our main goal.
Yeah. My other question I have, you know, our state just voted on Medicaid expansion, and God willing, we'll have a budget soon, and Medicaid expansion will be a reality. Do y'all anticipate, you know, an influx of calls once people have that coverage? From what you're seeing, are we prepared for that? Do we have enough places to send people who have Medicaid coverage? Like, have y'all been having those conversations? Just, you know, how does Medicaid expansion factor into this?
Yeah, that's a great question, Morgan. So, I think this is going to be something that we learn as we go. We're already getting lots of calls with the new different types of Medicaid, and we're having to kind of do research behind the curtain and figure out which facilities take what. And that's going to take time. That's not going to be something that I was just explaining this the other day to our team. This is going to be something that we learn about over time. And it's not something that we're going to be ready for next week. No, but we've got a great team of people that are looking for this information and seeking out these different facilities to figure out what takes or who takes what insurance. And yes, I do anticipate a lot of calls from people that just don't know where to start because they don't know where their insurance is accepted. So yeah.
If they don't have a phone, they're not able to call, is there a website they can go to? Is there online resources you want to share as well?
Yes, absolutely. So our website is alcoholdrughelp.org. You can search for resources by clicking on the resource button, and you'll be able to see there's a button for providers where they can enter their information, and then there's a button for people seeking resources, and they can click on that and go from there. It's pretty simple. You enter your zip code, and it gives you a list of programs in that area. There's other search criteria, of course, as well that you can enter.
alcoholdrughelp.org. Let me say that.
Got it.
So we have it right. Alcoholdrughelp.org. And then that phone number one more time.
1-800-688-4232.
Great.
Awesome. Well, Becca, I just want to say thank you for joining us. And I hope that we can kind of continue this conversation because I know you continue getting calls. You probably got people answering calls right now. And, you know, as we continue to see trends pop up in North Carolina, we would love to continue having you just come tell us what you're seeing, and so that we can keep
For sure.
up to date. And y'all really are such a great resource, and we want to just keep supporting you. So thank you so much for being here with us today. And we, like I said, we'll keep this conversation going for sure.
Awesome. Thank you both so much. I appreciate you. Thanks for the work that you're doing. It's important.
problem.
We're in it together. We're glad to
sure
have
are.
you.